Please remember at this time you should avoid putting your face near to the mouth and nose of a casualty. This video will demonstrate the first aid steps you should take to help a casualty who is bleeding. A wound that is bleeding can range from a minor bleed to a severe bleed. Remember, injuries can be internal or external. It may not always be easy to spot that a casualty is bleeding if the injury is on the inside of their body. Let's start by looking at how to help a casualty who has a nosebleed. Sit the casualty down and position them so they are leaning forward. This will help prevent the blood from running down the back of the nose and mouth and into the casualty's throat. Ask them to pinch the soft part of their nose for 10 minutes. They can do this themselves, but remember to reassure them and keep them calm. Check to see if the bleeding has stopped. If there is still blood coming from the nose, then get the casualty to continue to pinch their nose for a further 10 minutes. Check on the casualty again, and if there is still bleeding, ask them to continue pinching their nose for another 10 minutes. If the bleeding has not stopped after a maximum of 30 minutes, it's now time to call 999 or 112 for help. Remember to calmly give the call operator the correct information about the casualty and what has happened. Stay with the casualty until help arrives. If your casualty is injured and has a severe bleed, you should follow these steps in order to help them. If you can, put on sterile gloves, which will help to reduce the risk of infection for you and the casualty. There may be some in a first aid box, but if not, then please be as careful as possible when dealing with any blood. Apply pressure to the wound. This helps to slow the bleeding down, but it should only be done when there is definitely nothing stuck inside the wound, such as a piece of glass. Use either your hand or the casualty's hand to apply pressure. Now, you should apply a dressing to the wound, using a dressing pack from a first aid box if you have one. Open the dressing and place a pad over the injury. Use a bandage to secure this in place. Secure it tightly so it doesn't fall off, but make sure it's not too tight. You should now call 999 or 112 for emergency help. While you're waiting for help to arrive, monitor the casualty and keep an eye on the wound. If bleeding comes through the first dressing, then you should remove the first dressing and reapply direct pressure over a new dressing or pad to control the bleeding. Once bleeding is under control, secure the dressing with a bandage. Tie a knot over the pad to help maintain pressure. If you can see that there's an object in the wound, do not remove it. Removing the object could cause more damage, so instead, put a pad either side of the object and bandage carefully over the pads, without pushing the object into the wound any further. During any bleeding incident, you should keep checking for signs of shock. Shock can be a life-threatening condition, and the most common cause is severe blood loss. If you suspect shock, follow these steps. Treat any injury that may have caused shock. Using first aid to apply pressure and bandaging the injury could help to reduce the amount of bleeding and slow down the effects of shock. Help the casualty to sit up and assist them to lie on the floor. The casualty will be safer laid on the floor in case they are at risk of fainting, which may cause further injuries. Raise and support the casualty's legs if possible. Use a chair to keep the legs raised. This helps to keep the blood flow to the brain and other vital organs. It's now time to call 999 or 112 for emergency help. Remember to calmly give the call operator all of the information they need regarding the casualty and what has happened. Offer plenty of reassurance to the casualty and tell them that help is on its way. Monitor their condition and loosen any tight clothing. Keep them warm and wrap them in a blanket if possible, or a coat. Stay with them until help arrives and continue to keep them calm. Remember, your casualty's condition could possibly get worse, and they could even become unresponsive. If this happens, then be prepared to use basic life support and start CPR.